Hello, my name is Ana Avila and I'm a case manager at GSHC Surrogacy. Today we are going to be speaking of medical screening. Why medical screening? Going to medical screening ensures that we do have the best possible outcome for intended parents. We want to make sure that our surrogates, their hormones are at a great level to make sure they are pregnant and that we can ensure the surrogate is healthy enough to carry and have a healthy pregnancy. So how long does medical screening take? Well, it all depends where our GC is located. If you're coming from out of town and have a flight, we will plan for your stay at a local hotel and take care of all the logistics, any transportation that might be required of you. If a surrogate is coming from, say, Arizona to California, where the flight takes a couple of hours or so, they typically fly in and out within the same day. If they're coming from the East Coast to the West Coast, which could be Connecticut to California, we typically fly them out the day before and they leave the same day after their appointment. Additionally, the appointment takes about typically 45 minutes to an hour, hour and a half, depending on the clinic. Every clinic is very different, but it usually averages to an hour and a half. So how do you get there? How do you get from point A to point B? That's actually my favorite part. Providing support is something that us as case managers are really proud to do at GSHC. My job is to ensure that you have no blockout dates during your medical screening time. So first, I will run this by you, ensure that the date and the time provided works for your schedule. I will coordinate with you very closely on this and go ahead and schedule your flights. They don't have to pay anything out of pocket. I will provide you with an itinerary and show you how to request an Uber. If not, I'm able to do that for you. In order to make all of this process very successful and smoothly, we always ask to provide very close communication with us. We ensure that we are able to schedule everything as close in time as we can so that you are able to return as quickly as possible to your family. So what happens when you arrive for your medical screening? Well, you are required to arrive about 45 minutes before, typically, but it can vary from clinic to clinic. Upon arrival, you are checked in and they do give you questionnaires. You are asked a series of questions by the nurse and the doctor to ensure you are eligible and healthy to move forward. So what are some tests that you can expect during medical screening? For one, they do blood work so they can ensure your hormone levels are good and you have no sexually active diseases. Another test is a uterine lining ultrasound check to ensure your uterus is in a good shape to carry a baby. The third test they perform is the body mass index to ensure that you are within a healthy weight range to safely carry and deliver a baby. Every clinic has a different threshold and we must go based on their requirement to ensure that the GC carries a baby safely. An additional test that is done if a GC has a spouse would be sending them to their local LabCorp to ensure that they also get blood work done. So who can accompany you to medical screening? Well, unfortunately, due to the nature of the examination being so short and the trip being at such a quick turnaround time, there are no children or no additional people allowed to accompany you during medical screening. Although no one can accompany you during medical screening, we do allow for someone 18 and over to accompany you during embryo transfer. So how soon can you expect medical screening results? Well, that greatly depends on the clinic. Typically, on average, we usually see results come in within 2 to 3 weeks. So how do you find out your results? Usually the clinic communicates with you directly, where I am myself included in the email. I can also help relay these results to you. So what happens after medical clearance? The next step would be legal clearance. So we would start working on a legal referral where we would suggest a list of attorneys that you can work with, or you can also bring your own as far as he's eligible to work in the state that you are located in. It is important to note that every clinic operates differently. Every gestational carrier is also very different. It is even more important to make sure that you understand you are you in this journey, and your journey is unique. It is important to always stay true to yourself and not compare your journey to someone else's, because every gestational carrier, every clinic, and every intended parent is very different.